Hey, this is Dr. Susan Wilder coming to you with a Lifescape State of the Union update on this very tumultuous election week at a point where record numbers of Americans have exercised this incredible privilege to vote in free and fair elections. So I hope none of us take that for granted, and let's be grateful to all of those heroes, those patriots who are diligently counting every ballot and making sure that every vote counts. And I'm praying that, you know, all of us learn to take a breath and calm down, listen to each other, understand that we all fiercely love this country. We may have different ideas about how to go about resolving some of our problems, but I know we have the capability of working together if we engage respectfully. There is no liberty without civility. And along with record numbers of voters, we have record numbers of COVID cases across the nation. The vast majority of states noting upticks in cases. Now, part of that is due to testing, but there are also increasing hospitalizations, and which are followed by generally increasing deaths, which is particularly sad. We lost 235,000 American citizens. That's, you know, over 80 9/11s, not even within a year. And that's 19% of the global COVID mortality, with only 4.5% of the world's population. So we're not doing as well as we should be doing. And sadly, we're seeing lockdowns happening in Europe, which are the most draconian measure to get a pandemic under control. They should be entirely unnecessary if we stick to common sense public health measures. That means wearing our masks. That means avoiding crowded situations, staying out of indoor bars and restaurants, exercising outdoors as much as possible, and staying home when we are sick or we are exposed. I don't care what testing you've had. If you've been exposed to a case, a close contact to a case, meaning over 15 minutes of cumulative exposure within 6 feet to a case of COVID, you'd need to quarantine for 14 days. If you've got symptoms of COVID, you need to quarantine for at least 10 days from the onset of symptoms. Remember, we're most infectious for that couple days leading up to the onset of symptoms. And then, of course, many of our cases are spread without symptoms at all. And that's the scariest thing about this virus, is the stealth spread. Unfortunately, over 90% of us are still susceptible to this virus. The susceptibility rates have not changed despite the millions, over 9 million infections in our country. So that tells us about the immunity for this virus. It's not necessarily very lasting, so we would not rely on it. Continue diligent responsibility in terms of your public health measures. The infection fatality rate is still just an estimate, because until we know all of the infections numbers, we really don't know how many people are dying, but it's staying at about 0.65%, and that rate will not change until we have more effective treatments and or a vaccine. You know, so far one drug has been approved for the treatment of COVID. It is modestly effective in some hospitalized cases. It does not seem to affect, or remdesivir does not seem to affect COVID mortality benefit, but it does shorten hospitalizations, which can help us keep our hospitals from getting overwhelmed. I spoke to an infectious disease doctor last week, and definitely COVID case counts are escalating in our community, and the Arizona Department of Health Services website also notes that as well. You know, the most critical thing that we can all do is exhibit personal responsibility. And that's not just for protecting ourselves, but being thoughtful of our risk to others. Some very interesting data showed that, if we sequestered certain groups of the population, how well would that reduce overall infectiousness? And the most effective group to sequester was the 20 to 60-year-old age group, those with the most contacts out in the community, the most social contacts. Sequestering the elderly did not change the case hospitalization rates significantly at all. So, those who think we could just kind of sequester away the elderly and that will control this pandemic, that is looking like it is not an effective measure. That being said, schools are open without huge outbreaks if they are testing, tracking, quarantining effectively. And from what we've seen in our community, I think the schools are doing an amazing job. So I think, having our kids in school is still relatively safe. But again, they can transmit disease to their parents. Their parents may have risk factors. Other siblings may have risk factors. Grandparents, the cleaning lady who comes into a household, etc. So we have to think beyond ourselves. This is a disease where, again, we are interdependent. And, again, to remind people, testing is not a preventive strategy. Testing for COVID is not alone a way to control a pandemic. Testing for COVID is equivalent to trying to prevent pregnancy by doing pregnancy tests. You have to have all these other measures in place. And my favorite model that I think I posted on the Brilliant Health community is the Swiss cheese model that my daughter sent me that shows, every strategy has holes. But if we deploy all of them, we can dramatically put a lid on this infection and keep our hospitals from getting overwhelmed and keep our healthcare workers in those facilities safe as well. Also, I do hear from people at times, well, this is just a flu. This is no flu, especially for those who have risk factors or are older. We don't have any collective immunity to this bug. So, this is a brand new phenomenon in our global experience. And, we're just starting to see the long-term consequences, which I think are a bit concerning. So this is not a disease you just want to get over with. That is not something I would wish on my worst enemy. So be careful, be thoughtful, be responsible, and understand that, as Mother Teresa said, if we have no peace, it's because we have forgotten we belong to each other. So I think that's an important thing to think about with everything going on in the country right now. But I wish you peace, love, safety, health, and I wish that for everyone in our nation. So be safe, be good, have a great weekend, and a great November. Talk to you later.